Okay. Good morning, good afternoon, good evening to everyone joining us from around the world. I'm Angie Brasington, Senior Social and Behavior Change Advisor at the U.S. Agency for International Development, and it's my pleasure to welcome you to the second webinar in the Breakthrough Action Learning Series, From Insight to Impact, Leveraging SBC for Sustainable Change. Today's session is entitled Trailblazing Change, Institutionalizing SBC Innovation and Advocacy. This five-part series is designed to showcase the transformative power of social and behavior change, or SBC. Through these webinars, Breakthrough Action aims to inspire, inform, and encourage you to adapt these proven approaches to your own context. Next slide. Today, I'll be guiding you through this exciting session where we'll explore how Breakthrough Action is advancing the field of SBC by embedding it into regional, national, and community-level health and development practices. Our discussion will focus on localization byproducts that have emerged from this work, such as strengthening local leadership, securing local funding, building local capacity, and fostering local responsiveness. We'll hear from the following presenters today, each showcasing a unique aspect of how SBC has been institutionalized through localized innovations and capacity strengthening. Mohamed Sangare is the Regional SBC Advisor for Francophone West Africa with Breakthrough Action. He has extensive experience providing strategic support to countries in the region to maximize the potential impact of SBC for family planning and health programs. He will be presenting alongside Aaron Portillo, the Senior Program Officer for Family Planning at Breakthrough Action, as they share insights into their work with the Ouagadougou Partnership. Next, we'll hear from Dr. Dini Abu Bakar, Capacity Building, Community Management, and Partnership Advisor with Breakthrough Action, Save the Children Niger. Dr. Dini will share how the National Innovation Team in Niger is applying behavioral design to inspire health policy and change. Finally, we are joined by Aritha Labangura, Advocacy and Capacity Strengthening Specialist with Breakthrough Action Liberia, and L. Joseph M. Menlor, Executive Director of the Health Advocacy Committee in Nimba, Liberia. They will be discussing the journey of Liberia's health advocacy committees in transitioning into independent civil society organizations. We are fortunate to have this incredible lineup of presenters who are at the forefront of SBC innovation in their respective regions. Next slide. Before we dive into the presentations, just a few quick housekeeping items. This session will be approximately 60 minutes long, including time for Q&A segment at the end. We encourage you to submit your questions throughout the presentation using the Q&A feature. And we'll do our best to address as many as possible, either in the Q&A feature or live by the presenters. We're also pleased to offer simultaneous interpretation in French for today's webinar. To access the interpretation, please click on the interpretation icon at the bottom of your screen and select the language you wish to hear. This will ensure that all participants can fully engage in today's important discussions. So, without further ado, let's dive into our presentation about Breakthrough Action's collaboration with the Ouagadougou Partnership. Mohamed, the floor is yours.
Thank you very much, Angie, for your presentation, your introduction. Next one, please. I will be presenting a summary with my colleague Erin about the Ouagadougou Partnership. The Ouagadougou Partnership is a partnership created in 2011 by 9 countries, and with a goal to accelerate progress in family planning, but also being able to reach 13 million women using modern methods by 2030. This is supported by different partners like USAID and other partners, as you can see. Next one, please. We have founded our technical support on three main goals. The first one is to strengthen the strategy and operational capacities of SBC for the Ouagadougou Partnership Countries, enabling them to maximize the potential impact of SBC for the family planning interventions. We want also to strengthen the strategic support that we give to the countries. And finally, to be able to advocate for increased investment in SBC in order to be able to capture the demographic dividend. Next one, please. We started doing a situation analysis with our shared agenda. We have 5 priorities, as you can see. So we have 2 pillars, technical and financial. Even if the financial pillar is important, we understand that the technical part is our main priority, the main priority of our shared agenda, and is the main element that is guiding our strategic and technical support. Next one, please. In order to be able to give this technical support, we planify our support. We have a meeting, we create a action plan, we do the implementation of this action plan, we create a coordination, we have a follow-up, and then we start replanning the activities. We have 3 main interventions. We have 3 pillars, which is the strategic pillar with as you can see, with the maternal health. We have the capacity building, but also the operational pillar with different campaigns and also the demand creation interventions. Next one, please. In order to be able to work on the capacity building element, we start doing an assessment, identifying the what you can see in this image, which is something that helps us understand the Ouagadougou Partnership Countries. We identify their unique needs, and we understand that they have capacity that is acceptable. But then we created specific activities for capacity building. It could be on foundational concepts, social norms, provider behavior change, and we were able to build capacity of 637 participants across the government, implementing partners, youth, and other civil society members. Next one, please. Other key result that we had is our costed implementation plan. It's a roadmap that identifies the activities so that our vision is being able to be reached. We worked in strengthening this process in different countries, as you can see. Next one, please. We have different elements, as you can see, to be able to reach our goal. First, we have a checklist to evaluate the current CIPs and identify the gaps and opportunities to incorporate the SBC best practices. We then take into account the recommendations to be able to create the plan, the strategic plan. Another key result that we can share with you is the increase on the financial planning, 7% for, as you can see here, the different increases we had. Next one, please. And now I would like to give the floor to my colleague Erin, and she'll continue the presentation. Thank you.
Thank you, Mohammed. Breakthrough Action also worked closely with the Ouagadougou Partnership Youth Think Tank, or Think Tank Jeune, to support them to develop a regional and sexual and reproductive health rights bot, or DSSR bot, which is accessible in each of the 9 Ouagadougou Partnership countries. All said, the project strengthened the capacity of 120 young people on how to responsibly leverage digital technology to increase youth access to family planning and reproductive health information, and on the fundamentals of building and managing such a bot. Since its launch in 2022, nearly 14,000 youth have interacted with the bot through close to 245,000 messages. With Breakthrough Action support, young bot managers also conducted monitoring activities, and based on those results, removed less popular content and increased most requested content, including information on menstrual cycle management and where to find reproductive health services. Slide. Finally, the project collaborated directly with the Ouagadougou Partnership Coordination Unit, or OPCU. Breakthrough Action supported agenda development and meeting theme selection for the past 3 Ouagadougou Partnership Annual Meetings, or OPAMs, and has been instrumental in centering SBC as a lever for progress toward family planning goals in OP countries. In addition to delivering plenary presentations about SBC at these annual technical exchange meetings, Breakthrough Action organized parallel events, including very well-attended and high-level share fairs, where project team members worked alongside ministries and other stakeholders to identify SBC tools, approaches, and solutions to contribute to OP country family planning goals. While country youth leaders also participated in these share fair events, Breakthrough Action had the pleasure of working directly with Ouagadougou Partnership youth leads, including by facilitating a regional dialogue on elevating youth contraceptive access and experiences by repositioning adolescent and youth sexual and reproductive health narratives. This year, as a bridge between the 2023 and 2024 OPAMs, Breakthrough Action organized a virtual 3-day series of SBC-focused presentations and capacity-building mini workshops. The regional SBC days provided a forum for implementing partners and country stakeholders to dive deeper into topics in a way that's not always possible amidst the packed and multi-track OPAM agendas. The project also supported the OPCU to develop the research agenda and organized a virtual training on social norms family planning research. These efforts supported OP-based researchers to examine various family planning topics, including method discontinuation and youth family planning access and use, and the social and cultural elements that impact that access. Breakthrough Action also provided tailored research support and coaching to 2 Ouagadougou Partnership Coordination Unit grant recipient organizations, specifically helping to build social norm research capacity among younger and less experienced researchers. Such capacity strengthening will help generate new evidence and insights into key family planning hurdles and challenges in the Ouagadougou Partnership community. Slide. These efforts have also encountered some challenges along the way, including maintaining stakeholder buy-in or moving forward with in-person activities amidst security and political shifts in countries such as Mali, Niger, Guinea, and Burkina Faso. Of course, we've also seen staffing changes over the years among key regional decision makers and national ministry staff. Here, while the project formed new relationships with relevant focal points, in some cases it did impact activity momentum or the level of advocacy that was required to maintain SBC as an FP priority. Slide. However, despite these challenges, Breakthrough Action has seen notable results, including increased SBC inclusion in costed implementation plans and national family planning and reproductive health strategies, increased local government funding for stronger SBC implementation, increase personal investment in SBC, as evidenced by nearly 1/3 of registered users on BA's SBC e-learning platform hailing from OP countries, and increase regional appreciation for SBC as we've seen it become a more permanent fixture in the Ouagadougou Partnership annual meetings. Following Breakthrough Action's technical assistance, ministries of health in Benin and Senegal have also mobilized their own resources to continue using Breakthrough Action tools and approaches to improve service quality in family planning and also revamp national family planning campaigns. This SBC ownership has been incredible to witness and is just the beginning of SBC's growth in the region. Thank you so much.
Thank you, Mohammed and Aaron, for that insightful presentation on how SBC technical assistance has led to meaningful changes at both the regional and national levels. It's inspiring to see the direct link between capacity strengthening and greater national investment in SBC through the improved integration of SBC into family planning costed implementation plans at the country level. Please share your any questions or comments that you have for the presenters in the Zoom Q&A, and we'll keep them for the Q&A session of the webinar. So we will now move on to our next speaker from Niger, Dr. Dini.
Thank you very much for the presentation. And it is for me a pleasure to be able to present these different team and the results that we found out. I would like to tell you that we have a multidisciplinary team, multi-sectoral team. We have about 30 members. And our main goal is the capacity strengthening and inspire change in the authorities, political authorities. Next one, please. So what is our inspiration? The systematic application of knowledge were based on hypotheses and subjective questions. They were based on assumptions. And now we are trying to think instead of letting the community think. So we have a limit on our behavioral change and the sustainability of our actions. The application of SBC is needed to be able to engage and help the political actors for them to be able to elaborate and implement programs that are based on the social, cultural, and economic fields. Next one, please. Here you can see our first team, the first cycle, if I can say it. And they were working with the support of Breakthrough Action. They had different coachings combined with in-person sessions. So we had about 30 experts in the innovation field, in the behavioral innovation field. Next one, please. I said it already. We have a team that is national, but also regional. We also work with different implementing partners from USAID. Next one, please. For the skills building, what are those skills building that we had, the capacity building? We had remote online coaching, and as mentioned previously, the combined in-person sessions. We also have these in-person sessions. We have a trainer, national trainer, and we have 2 coaches per region in the Ouagadougou region and another region. For these coaches, they had 3 interactive modules covering behavioral design and common design principles, multimedia presentation, and real-life case studies. Next one, the process. To be able to constitute these teams, starting from cycle 1 and cycle 2, we have to say it's a process that takes into account the peripheral point of view, but also the political actors. First, we developed and tested a prototype for complementary infant feeding. And then for the second cycle, we developed and tested 4 additional health prototypes: nutrition for pregnant women, postpartum contraception, prenatal care, and reducing open defecation. Next one, please. So you can see on the screen the outcomes are of our first cycle. These supplementary feeding for infants. And here you can see it has instructions on how to prepare them, how to keep it, and you have all the necessary instructions to be able to use this enriched flour for the supplementary feeding of infants. We do it at a local level. They are also very used in using these enriched flours. And as you can see, we can have the instructions on next one. So why does this process work? The first element is that it helps and empowers the decision makers. They're able to define their priorities and target priority behaviors within the framework of national strategic objectives. It also helps with the expansion and understanding of behavioral interventions. And the third point is the shift perception of the target audience. We can see here, for example, one of the members of the Communication and Public Relationship Ministry of Public Health that said, we've started paying much more attention to mood, physical environment, and social context. And she changed her point of view. And she said, we didn't consider these things before. And she thought they were important now. Next one, please. We have a second element with Pinta Chiombiano. She was the communicator in Directorate of Family Planning at a different level. And we're going to hear her. She's speaking again about this specific approach. NE has allowed us to design differently. It's not longer the way we used to make media like that without thinking. It has now allowed us to understand the perceptions, attitudes, and behaviors of our communities in order to propose appropriate solutions. It has also allowed us to improve the way we work. When we take procrastination, we no longer pile our work. And also, the marketing system allowed us to present our promotional services in a different way to be able to achieve our goal. I would like this initiative to continue, to scale it up. And for that, we need to start by developing the module and the behavioral economics in human-centered design, training a pool of trainers, and also integrating these modules into the curricula of health institutes. Thank you very much. So, what is the impact of this approach? First, we can say that we have innovative solutions for the adoption or implementation of the health promoting behaviors. At the ministry level, health ministry, environment ministry, territory ministry, and different public health ministries. So we have the innovative solutions, but we also have experts that are available to build expertise in behavioral economics and human-centered design. We also have capacity building that these experts are doing at the national and local level. So besides the ministries, the different ministries we spoke about, these tools are available online and anyone can use them. But we also want that these tools to be used by the different institutions. And that's why we spoke with more than 50 students that are in the communication field and that will be our next champions on behavior change. Sustainability is key. So we need these experts and we need to continue with our advocate actions to continue with these trainers and these different skills. I would like to say that this strategy attracted the interest of public, but also on the private sector players. It is a specific approach. It's our future, and it's a very well implemented approach. We do have a couple of challenges. For example, the resources, because of course it takes a lot of time. We have to have a prototype. We have a test phase. So for us, the challenges would be the resources to be able to continue using this approach. Next one, please. Thank you very much. This is the end of my presentation. Thank you.
Thank you for showcasing the incredible work happening in Niger through the Sahel RISE II initiative. The capacity building efforts of the National Innovation Team truly illustrate how localized SBC solutions can address complex challenges while building long-term resilience. That was really impressive. If you have any questions about the presentation, please submit them in the Zoom Q&A and we'll address them during the webinar's Q&A session. So last but not least, we will hear from Aretha Bangura and Joseph Benlor of Liberia. Over to you, Aretha.
Good afternoon. It's my pleasure to share our work with influential community leaders to influence change in Liberian communities. Over the last decades and more, there have been a lot of donor support and government commitment to improve health outcomes in Liberia. However, Liberia continues to have poor health indices, for example, high maternal mortality rate and high unfit mortality. The Liberian Demographic Health Survey shows that many of these poor health outcomes are as a result of the low utilization of health services across the country, with people opting for informal and traditional care rather than the modern healthcare services. This is more in rural areas where several psychocultural factors influence health behavior, as seen during the Ebola outbreak and COVID vaccine rollout, where community resisted preventive measures and when they felt it did not align with their norms or religious values. It is a known fact that local leaders such as customary chiefs and local government authorities in Liberia play a major role in influencing communities, their health behaviors and practices. As such, Breakthrough Action Liberia sought to work through influential community leaders to influence community member views and opinions, inspire change among community members, making them a crucial resources for sustaining SBC efforts for improving health outcomes and change social norms and reduce harmful practices that negatively affect health. Next slide. Therefore, we adopted the smart advocacy approach from Breakthrough Action Nigeria to equip influential community leaders with the skills to lead efforts to influence social norms positively in their communities, strengthen their capacity to identify and resolve health issues using the advocacy skills, lead and participate regularly in improving laws and policies that promote health. The smart advocacy approach applies practical principles, making specific, measurable, attainable, relevant, and time-bound goals, and step-by-step actions to change making and changing a bigger goal. Next slide. One key step before the training was to ensure that we selected the right people and the decision who could influence change in their communities to participate in the training. As a result, we developed a selection criteria that outlined all the characteristics and attributes required. The selection criteria include voluntary participation. Voluntary participation was a very important criteria from the beginning because we wanted to ensure that participants were self-motivated and driven to lead on the issues identified. For a long time, due to the emergency response during the war and the health crisis from Ebola and the COVID, many community members focused on incentives. It was very common for these incentives when withdrawn, the intervention failed. Keeping this in mind, it was crucial to ensure voluntary participation from the beginning of implementing the smart advocacy approach in Liberia. Be an influential community leader because of their high status and position in society ensure that other community leaders will listen to them. Have basic skills about health. Initially, female participation was low because there were fewer female community leaders. To address this, we revised the selection criteria for women to include influential individuals rather than leaders. We also work closely with the county and the district health teams to identify participants and verify that they met the selection criteria. Next slide. After selecting participants for the training, BA conducted SMART advocacy training in all 12 counties. One training was held in each county. The training helped participants to understand how to identify or health challenge in their community. For example, by discussing with the facility health providers or noting the health issues that were important to the community members. Understanding the underlying factors, that is, identifying the factors that brought about the current health challenge. Map up the relevant stakeholders for engagement, that is, identify those in authority that can bring about the desired change or support the process to advocate for change. Engage and follow up, that is, understand the different techniques to advocate and understand the importance of following up until they achieve the desired change. The training used different teaching methodologies, including role play, team building exercise, and in-depth discussions in a local vernacular to ensure that participants understood the lesson taught. By the end of the training, participants were established into groups comprising of 26 to 30 members from the same districts. This resulted in 47 health advocacy groups across 12 counties. The group were named Health Advocacy Committee by the Ministry of Health. The group were also linked to the county health promotion and the community health focal person, who served as a focal point between the HAC and the county health teams, and was also responsible for ensuring that the HACs participated in district and county coordination meetings. After the training, Breakthrough Action Liberia conducted a follow-up visits to the HACs in their communities to provide on-site mentoring and technical support. BA also hosted an experience sharing event which enabled HAC members from different groups to interact, share their experience, and learn from the experience of others. The Nima County HAC is one of the exemplary groups that hit the ground running and were able to serve as a role model to their peers. We will listen to their testimonial of the chairperson of the HAC from Nima. Next slide.
Ms. L. Joseph M. Miller, Executive Director of Nimba Health Advocacy Committee. It is my honor this afternoon to share with you our experience in championing health advocacy in Nimba County. Breakthrough Action Liberia mentored us in 2021, February, as Health Advocacy Committee, and gave me all the skill of smart advocacy. With the smart advocacy skill, we identify issues, we gather evidence, we map relevant stakeholders, we engage them, follow up to ensure that the rightful things are done positively in the community. Our advocacy techniques have helped us to achieve in many different ways. In Nimba County, in the Zoge Health District, the community, having worked along with them, they were successful in repairing and restoring ambulance services to the Ban Health Center. And in the Bele area, the community, having worked along with them, were able to renovate Duple Health clinic, and then build public toilets and hand pumps in the city of Kantley. So this smart advocacy has really helped us, and our relationship with stakeholders now have been built properly. We have harmonized ourselves and transitioned our organization into a full-fledged civil society organization duly registered with the government of Liberia since December 2023.
Next slide. Despite the initial successes achieved by several HSC groups, there were still challenges that prevented them from achieving their full potential. For example, some group members still expected to receive incentives in the form of stipend or direct payments from the donors or government. This expectation influenced their participation in group meetings and advocacy events. Partly responsible for this was that HSCs were perceived as community health groups, such as the Health Facility Development Committee, which served as a liaison between the community and the health facility. Additionally, while the HSCs were good at identifying health challenges in their communities and districts, they were unable to identify the resources to address these challenges. They also faced challenges raising funds to continuously follow up with relevant stakeholders. Therefore, it became important to equip the HSC member with additional skills that help them mobilize resources and effectively manage their community projects. Notwithstanding these challenges, we found that HSC members were interested in acquiring new skills, which helped them to overcome several challenges and achieve more successes. Next slide. To ensure that HSC had the skills and knowledge to function effectively, Breakthrough Action Liberia re-strategized its support for HSCs to include a remedial plan of action to address the challenges identified. The plan included linking HSCs to other groups and platforms so that they could build networks, share their achievements with a wider audience, and be exposed to other approaches used by similar groups in a shared community of practice. Supporting HSC to transition to a civil society groups by providing technical support to complete all the required registration and documentation, such as updating their bylaws and constitution. Additional sessions included in the bylaws made provision for recruiting new members and outlining their financial policies. Breakthrough Action Liberia also developed a coaching tool that covered topics such as leadership, resource mobilization, and budget management. The tool was developed using a simple language and practical examples that are relevant and applicable to the HSC members. It is used over a period of 6 weeks to provide a one-on-one or small group coaching sessions. One lesson is treated every week, and there is an opportunity to recap and go over the topics that were previously discussed. Next slide. Over the last 1 year of implementing the remedial action, most HSC has made a remarkable progress. 47 district level HSCs were successfully consolidated into a county level group, such that we now have one county level HSC with one county level leadership structure supported by the initial 4 district level subgroups. The structure enables the HSCs interact with the local government authorities while still being linked to their communities and to the grassroots. The new structure also allowed the HSCs to constitute a board of directors, recruit new members, and institute annual dues on their members as a form of generating funds that enable them to follow up on advocacy issues. 3 groups, namely LOFA, NIMA, and Margibi County HSC, has secured and opened their office space, which they also use as a meeting venue. Since transitioning to the county level group, 10 out of 12 groups have obtained their legal registration as CSO. The remaining 2 groups have raised up to 50% of funding required to get registered. Several HSCs have also applied for or indicated interest to partner with other or longer CSO groups to bid for community level grants. They also continue to work with the county health teams and advocate with the local government authorities. Thank you.
Thank you, Aretha and Joseph, for sharing Liberia's inspiring journey for transforming health advocacy committees into self-sustaining CSOs. That was really great. This transition is a powerful example of how local leadership and capacity building can drive long-term change and strengthen health systems from within. So now we'd love to open the floor for any questions or reflections you might have. We have about 10 minutes, and please feel free to type them into the Q&A, and we'll get to as many as possible. I see a couple have already been answered in the Q&A. Anyone else want to ask our panelists a question?
Angie, I thought it was very interesting, the comment that had come in the Q&A from the university practitioner, speaking about how some of the older practices and older approaches are still being taught at university level. And I know Breakthrough Action is also working in the Democratic Republic of Congo on integrating some of the materials into the university system there. But I wondered if Dr. Abubakar could speak a little bit more, or maybe it was Sangare, sorry. Dr. Sangare could speak a little bit more about any integration into university level work at all.
Yes. As I stated in my responses, we worked closely with the Ouagadougou Partnership so that the agenda was large enough to be able to work with the universities so that they can help us elaborate this agenda, so that the research is considered a main element that we are going to be using in our interventions, but also to be able to share the results of different researches. We work with researchers, and when we work with them in different sessions, different universities were able to participate, and we also had different proposals for Niger, but also for Benin, so that they can integrate in their National Institute of Public Health the research on social norms, to be able to integrate these in different universities. But as I was stating, the universities for the technical support were not our main target. But because of how things went, we were able to work with these universities. And in other countries, like in Mali, universities were included by the Ministry of Public Health. They were included for all the SBC activities in Mali, for example. Thank you.
Thank you. And if I could just add also, under West Africa Breakthrough Action, we've also had, in particular, university professors and students in certain advanced degree programs approach the project for, I won't say technical assistance, but capacity sharing for social and behavior change. And we've now got a small cohort of around a dozen students and professors from a university in Togo who are now making their way through SBC courses on SBC Learning Central. So even outside of the realm of the pointed technical assistance, we're also finding those opportunities to work with university students and faculty members in other ways under the project. Thanks.
Other questions?
Maybe while people are coming up with their questions, I'll give an additional plug. Erin mentioned SBC Learning Central, and I'm sure Lisa Waikambo would be happy to put the link in the chat. For those who aren't familiar with it, SBC Learning Central is a free online platform where people can take classes, different lengths of time and different subject areas, but all under the auspices of social and behavior change. So for anybody listening who would like to build their own capacity, definitely check it out and share the resource with your friends and colleagues who also might be interested to learn more, because it's a great resource. Thanks.
Great. If we don't have other questions, I have a question for our Liberia team. Aretha and the executive director, fascinating the great deal of work that went into formalizing these health advocacy committees. And I wondered what sort of reception you received from county level government. How are they feeling about having you in partnership to identify issues and solve them together? How has that been? If you could speak to that.
I will give Joseph the opportunity to come in, and then I will add.
Okay, so thank you for that question. What comes to the issue of reception received from the county, level authority, we are warmly received and accepted by the county level authority because, in the first place, we are ensuring that the community themselves are innovative in taking a decision and supporting their own plan of action to have a social behavior change and to positively impact, their status. So our contribution is seen by the county level authority as such that it's another way of, adding up to the government, effort in making sure that citizens live a healthy, life.
Thank you, Joseph. Just to add to what Joseph said, initially when we started the project, we brought in the county health team and the district health team to be the one recruiting the HAC members. So with that approach of their involvement, serving as the key actor to recruit the HAC members from the community, we got their buy-in, and then they started to support us throughout the process. And then, like you saw in the presentation, they assign the health promotion focal person and the community health focal person to work directly with the health advocacy committee to serve as liaison, and then to also ensure that health advocacy committees are aware of all the county coordination meetings. So they got the buy-in and they continue to support the work of the HACs, because from the onset, we told them that the health advocacy committees are here to buttress the effort of the county and the district health teams.
Thank you for that. It's fantastic and so nice to see that your attention to the financial sustainability too through membership dues and things. I'm looking forward to hearing more about how these grow in the coming years. Elizabeth, were you thinking you had, or does anyone else have another question? We're about at time here, but we could probably squeeze in another one.
Yeah, I do have one more question, but if anybody else had something else they wanted to raise, feel very free. Otherwise, my question was thinking about the applications of SBC, and we very often think about it in the context of like the Ouagadougou Partnership, which is very much focused on family planning and sexual and reproductive health. But I'm wondering if any of our panelists would like to speak about applying social and behavior change to more than one health technical area. You may have come in thinking you're going to apply it to sexual and reproductive health, but ended up finding a really useful application in another health technical area. Or maybe in the context of Liberia, it was each county or each community was identifying the areas that were most suitable for an SBC approach. Thank you.
Dr. Denis, can I call on you? In Niger, it seemed like you were addressing multiple health issues with nutrition, sexual reproductive health, and also WASH with hygiene. Did that seem like, did you have difficulty in trying to figure out how much emphasis to put on each, or what was that experience like of using SBC across multiple health areas? Over.
Yes, thank you very much. So concerning these different issues, we did a process follow-up with ideation with the Ministry of Health and with the Ministry of Water and Sanitation and the Ministry of the Territory. We were able to understand different needs and problems. We worked on specific indicators. Then we analyzed the indicators and we understood that the first problem, the first issue was nutrition. Nutrition was a real problem, a problem that is present in all the regions of Niger. And we couldn't find a solution. So that's why at the beginning, we had 4 teams working on the first cycle. And those 4 teams were working on the same topic, which was the supplemental feeding for infants, specifically for nutrition. And during our second cycle, that's when we said, okay, nutrition is an issue, but we have other issues too. But through the indicators, we were able to see that defecation in an open space was a problem because of the diseases and etc. We also worked on family planning, and we understood it was a problem because our indicator was very low at the Ministry of Health level. So we thought about a solution, and we were saying, okay, how can we find an innovative solution? And we worked with the Ministry of Health through the family planning department.
Thank you for that additional information. It sounds like it was really a rich experience for everyone, and so glad that I'm sure capacity in all of those areas was able to improve to see how SBC works across all of them. I see that we're at time now, and I just want to quickly wrap up and let you all know that to thank all of our wonderful presenters for sharing such impactful examples of how breakthrough action is institutionalizing SBC through localized solutions. We've seen how technical assistance, capacity building, and strategic transitions have elevated SBC as a critical component of health and development efforts at every level. I also want to thank all of you for participating and for your thoughtful questions and comments. Before you leave the webinar, please complete the 4-question poll. This will help to inform future webinars in this series. And we also encourage you to explore additional resources that expand on today's discussions via the links shared in the chat. These resources will further enrich your understanding of how breakthrough action has advanced the field of SBC. And finally, this is just the beginning of our journey in this series. Breakthrough Action invites you to join the next webinar in the series, Leveraging SBC to Strengthen Health Systems. That will be on December 10th. And so until then, thank you and take care.